Another day, another story. Hemodialysis is a medical treatment used for patients with chronic kidney disease or acute kidney injury. The process involves removing waste and excess fluids from the blood, which are usually eliminated by the kidneys. In this article, we will provide an overview of hemodialysis, its indications, preparation, procedure, complications, and alternatives. Indications for hemodialysis. Hemodialysis is indicated when the kidneys are unable to function effectively. It may be necessary for patients with chronic kidney disease, which occurs when the kidneys are damaged and unable to remove waste products and excess fluids from the blood. The treatment may also be required for patients with acute kidney injury, which may result from injury, infection, or medication toxicity. Preparation for hemodialysis. Before the procedure, the patient's medical history, medication use, and laboratory tests are evaluated to determine the appropriate hemodialysis prescription. A vascular access site is established to allow access to the bloodstream for the hemodialysis treatment. This may be done through a surgically created fistula or graft, or through a catheter that is inserted into a large vein in the neck or groin. Procedure for hemodialysis. The hemodialysis procedure involves the use of a machine that circulates the patient's blood through a filter called a dialyzer. The dialyzer is made up of tiny tubes that are surrounded by a fluid called dialysate. The blood flows through the tubes, and waste products and excess fluids pass through the walls of the tubes and into the dialysate. The hemodialysis machine monitors the patient's blood pressure and the rate of fluid removal during the procedure. The patient's blood is pumped out of the body, passed through the dialyzer, and then returned to the body. The procedure usually takes several hours, and patients typically undergo hemodialysis several times a week. Complications of hemodialysis. Hemodialysis may cause complications, including low blood pressure, bleeding, infection, and cramping. Low blood pressure may occur during the procedure and may cause lightheadedness, dizziness, or nausea. Bleeding may occur at the vascular access site or from the patient's gums or nose. Infection may occur at the vascular access site or in the bloodstream. Cramping may occur in the patient's muscles due to the removal of fluids and electrolytes during the procedure. Alternatives to hemodialysis. There are alternative treatments to hemodialysis, including peritoneal dialysis and kidney transplant. Peritoneal dialysis involves the use of a catheter that is inserted into the patient's abdominal cavity to remove waste products and excess fluids from the body. The dialysate is introduced into the abdomen, where it remains for several hours before being drained. Kidney transplant is a surgical procedure in which a healthy kidney from a donor is transplanted into the patient's body. The transplanted kidney takes over the function of the patient's damaged kidneys. Kidney transplant is a more permanent solution than dialysis, but it requires the patient to take immunosuppressive medications for life to prevent rejection of the transplanted kidney. Conclusion. Hemodialysis is a medical treatment used for patients with chronic kidney disease or acute kidney injury. The process involves removing waste and excess fluids from the blood using a machine called a dialyzer. Hemodialysis is indicated when the kidneys are unable to function effectively, and it may cause complications, including low blood pressure, bleeding, infection, and cramping. There are alternative treatments to hemodialysis, including peritoneal dialysis and kidney transplant. Share and subscribe Nature Fella.